Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What are the most common causes of urinary incontinence? Urinary incontinence occurs when you cannot control your bladder and you leak urine. The main types are stress incontinence, in which you leak when you cough or sneeze, and urge incontinence, in which you suddenly need to pee but can't hold it. Other types include overflow, total, and functional incontinence. /r/n/r/n A healthcare provider can help you determine the cause and course of treatment. /r/n/r/n This article covers the causes of each type of incontinence and available treatment options. /r/n/r/nljubaphoto, Getty Imagesrnrn Urinary incontinence can result from daily habits, such as drinking too much caffeine, health conditions, or medication side effects. Some causes, like infections or constipation, can lead to temporary issues, while others, such as diabetes or spinal cord injuries, can cause long-term problems. /r/n/r/n Stress incontinence occurs when pressure on your bladder causes urine leakage, especially when you cough or sneeze. Weak pelvic floor muscles, which normally keep the bladder and urethra, the tube that carries urine out of your body, closed, are the leading cause. When these muscles are weak, they can't hold back the urine under pressure. /r/n/r/n Urge incontinence happens when you suddenly need to pee and can't hold it long enough to get to the bathroom. Underlying causes include /r/n/r/n Overflow incontinence is when your bladder doesn't empty completely and fills until it overflows. Weak bladder muscles, a blockage in the urethra, or nerve problems can cause this issue. Over time, if the bladder stretches, it may not send strong signals to the brain, so you might not feel the urge to pee even though your bladder is full. /r/n/r/n An enlarged prostate is a common cause of overflow incontinence in males. As the prostate gets bigger, it squeezes the urethra, causing urine to back up, similar to a clogged sink. At first, a little water might linger in the sink, but if you keep the faucet on, the sink will eventually overflow. /r/n/r/n Total incontinence is when you cannot control your bladder at all. Serious issues like spinal cord injuries, conditions present at birth, or nerve damage can cause permanent incontinence. However, if an infection is the problem, it may be temporary, and treatment will likely improve it. /r/n/r/n Functional incontinence occurs when physical or mental issues prevent you from getting to the bathroom in time. Conditions like arthritis or memory problems can make it hard to move quickly or remember to go, leading to accidents even if your bladder is healthy. /r/n/r/n Incontinence can be a medication side effect. For example, antihistamines like Benadryl, diphenhydramine, can block a chemical that helps the bladder empty completely. Diuretics like Lasix, furosemide, which help remove excess fluids and salts from the body, increase urine production, which can overwhelm the bladder. Other examples include /r/n/r/n There are many risk factors for incontinence depending on the condition. Examples include /r/n/r/n Risk factors that increase the likelihood of incontinence include /r/n/r/n When treating urinary incontinence, healthcare providers look for obvious causes, like an infection or constipation, and treat those first. They may also recommend lifestyle changes, such as avoiding alcohol, caffeine, cigarettes, and spicy foods, or losing weight. Treatment can also be specific to each type of incontinence. /r/n/r/n Stress incontinence treatment options include /r/n/r/n Urge incontinence treatments include /r/n/r/n Treatment for overflow, total, and functional incontinence involves fixing the underlying condition when possible. Overflow incontinence often requires surgery, like a prostate reduction. A urinary catheter or supportive care, absorbent products, may be necessary to treat overflow or total incontinence. In addition, the following may be beneficial for those with functional incontinence. /r/n/r/n Urinary incontinence can be embarrassing and inconvenient, but there are ways to manage it. Contact a healthcare provider if it interferes with daily life, causes emotional distress, or if you experience the following. /r/n/r/n Seek emergency care if you experience. /r/n/r/n Urinary incontinence occurs when you lose control over your bladder and this leads to urine leakage. The main types are stress and urge incontinence. However, you can also experience overflow incontinence, total incontinence, and functional incontinence. Underlying causes might involve bladder irritants, weak bladder muscles, medication side effects, diabetes, prostate problems, menopause, or surgery. /r/n/r/n While some types of incontinence may respond to lifestyle changes, others may require medications, medical devices, surgery, or urinary catheters. If you experience incontinence, contact a healthcare provider to understand your treatment options. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.